I'm fine. Thank you. Thank you for joining us today. It's a pleasure to have you.
It's my pleasure too. Thank you for having me for the evening.
Yeah. So I'll just quickly introduce today's topic to our audiences, and after that, we'll get into our topic of the evening. Yeah. So good evening, everybody. Thank you for joining us today. I hope you're having a wonderful Sunday evening, and with us, it's been a while since we've talked about a very specific topic on mental health. So, with Ms. Priyadarshani today, we will be, deep diving into clinical depression and the symptoms and the interventions that are available today. Along with this, just to give you some background, uh, Priyadarshani is a counselor and psychologist. Uh, she's based out of Coimbatore, and she's studied across the she studied across the globe, and she's pursued advanced diploma in transactional analysis and a diploma in community health for psychologists at Nimhans, right? In
Yes.
addition to this, okay, you and her focus is on counseling and therapy for children, adolescents, students, couples, and families. And also, she also works with anxiety, depression, substance abuse, life skills, and leadership skills training. Okay. So, Priyadarshini, is there anything else that you would like to add to this?
No, thanks. Oh, you have covered all the parts, areas.
Thank you. My first question for today is, and it's quite straightforward. What is the difference between depression and clinical depression? Is it the same thing, or how? Well, when does one work? When do you say you have? How does it work? What is it? So,
Yeah, so it's a good question. Actually, depression is a mood disorder that can affect a person's daily life. It may be described as feelings of sadness, anger, and low mood. So this is the mild part of depression. So when it goes to a severe thing, it is clinical depression.
okay,
So I think I've answered your question.
right, right. Okay, so
Yeah.
and
So yes, tell me.
so how is severity defined?
The severity defines on the a test which is taken by the clinical psychologist. So it's based on the test how the patient or the client is. For example, if it is a clinical depression, we otherwise called it is a major depression disorder, where the patient will be where the client will feel the I'm talking about the symptoms of the clinical depression, where they will have a very sadness, the energy level will be very low, there will be fatigue, and they don't have interest to do their things which they want to do. For example, their hobbies, low mood in sex life, and they have unexplained physical problems such as headaches, body pains, and frequent and recurrent thoughts of death, suicidal thoughts they'll have, and they even attempt suicides. And they'll have sleep disturbance. Sometimes there may be insomnia, where they sleep for more time and they won't sleep at all, and there will be a weight loss. So these are the symptoms for the clinical depression. Whereas when you talk about the mild to moderate, the basic things of loneliness and low mood, and not involving in everyday work. So these are the symptoms which talks about mild to moderate level of depression.
Okay, okay. And is there a way for self-assessment based for clinical depression before you realize, okay, I need to meet a doctor to get this to seek treatment?
Yeah, it's an excellent question. Actually, these signs which I was talking about, the signs and the symptoms which your body gives, is a alert to, for the a client or a patient to consult the doctor. So when you see these kinds of symptoms in you, then it's a right time you have to consult the psychiatrist or the counselor. So, for the mild and the moderate level of depression, a psychotherapy will work. The counselor can do a talk therapy, or maybe CBT will work. There's a lot of different therapies available, like existential therapy, transactional analysis. There you have gestalt therapy. So it depends on the counselor and the client, the need of the client. So each client is different and unique. So based on the client, the therapy will be the interventions will be given. If it is a severe case, then a combination of medical intervention and the therapy will go hand in hand. So, this is how it works.
Okay. And okay, uh, is there a way? So depression, uh, does it have anything to do with? Can anyone get it, or how do you get? As in, uh, obviously there must be certain reasons, external influences.
Yes, yes, yes.
So
Yeah, let me tell you. So the cause for getting the no, everyone can get it, but as per the ratio, women gets no highly. The depression in women is higher than men. So how it is caused? It can be genetical. It can be genetic, or some brain chemicals, or it can be a lifestyle, or it can be the personality also. So based on this the depression is it's been seen in the client.
okay, and of course, I'm sure, like any so, okay, so there are two more things. I was reading up on the WHO, to understand depression better. I was reading up on WHO, and I realized that there are two types of chronic depression, right? So one was, can you help me understand a little bit more about recurrent depressive disorder, and the other one was bipolar affective disorder. I've always, amongst us friends, when we were in college, we used to there was this we used to pass this comment when somebody used to keep switching between things. So this guy seems to be bipolar, particularly about the teachers actually sometimes. So is can you help us understand? I know it was very mean, but can you help us understand what is the difference between recurrent depressive disorder and bipolar affective disorder?
Yeah, bipolar disorder associated with episodes of mood swings ranging from depressive to low to manic highs. So these are all related to depression, but in a different stages. Bipolar is related to mood swings. Like if you have an episode of mood swings, like it can be low or it can be very high for 2 to 3 weeks, then there is a chance of having a bipolar. So this has to be again consult the clinician and get the intervention accordingly.
Okay, and treatments. What are the different types of treatment options?
The treatment options, as I told you, it always have to go hand in hand, your medical intervention and your therapy. So it's like your if you get a physical illness, for example, if you hurt your leg and you consult the ortho, and the ortho refer you to a psychotherapist. I mean, sorry, uh, I'm sorry, refers to a I'm sorry, I'm not getting the
Therapist.
name. Yeah, uh, physiotherapist.
Okay,
So
sorry.
it's like that. So after your medical, I mean your medicine given by the ortho and the physiotherapist work hand in hand to back in shape. The same way here, the medical intervention from the psychiatrist and the psychotherapist or the counselor work hand in hand to help the client to come out of the manic.
Okay, okay. And Is there, do you have medication that's available for the treatment of?
Yes, but there is medicines available for these kinds of treatments, antidepressant medicines. So it depends on again the level of the or disorder, and that can be prescribed by the psychiatrist only. A psychologist or the counselor are not allowed to prescribe the medicines. So this is a very very important thing which everyone should understand. So in case if you come, if I'm just telling to everyone, in case if you come across anybody prescribing you medicine, please don't have it unless otherwise if it is prescribed by the psychiatrist.
Okay, so only a psychiatrist is supposed to.
Yes, yes.
Okay, okay. So I don't know. I'm not sure if this is relevant to the context of India. But yesterday, again, when we were reading about depression, I stumbled upon this code called ICD-10.
Okay.
Are you familiar with what it is? Because I believe what I understood from it is, and there was a big surge in the search of ICD-10. Let me just Google that and check if I
Yeah.
was ICD-10. Yeah. So it seems to be a code for depression. Is there something we need to pay
No,
attention to?
those codes are for the clinicians to follow.
Okay, okay.
Yeah.
Is depression? Sorry, you were going to say something,
No,
Priyadarshini?
no, no. Ask me, please.
Yeah. Is depression covered under insurance? By the way,
In India, it is not covered under insurance, for sure.
that's interesting. So just out of curiosity, I've not asked anybody.
But yeah, but if the client or the patients have IDD, so intellectual disabilities, or if the patient has no schizophrenia on the higher level, and if they cannot depend, I mean, if they are dependent on somebody, then there is some concessions given by the government, but there's no insurance covered in India.
Okay, okay. And typically, just how long does the treatment or the therapy journey? What is the typical? How long does it last, and what
Yeah,
what are
it's
the
a very good question, but it depends purely on the client. So sometimes a client may take 3 months time, sometimes a client may take more time, and there are relapses also. So it's purely depends on the client.
okay?
So if they are very cooperative and follow the no the things given, the activities given by the counselor, and taking the pills properly, then the recovery will be on the faster side. So if it is going to be like they keep missing the sessions, and they don't follow the activities or the pills given by the concerned person, then obviously it will take time, and there are chances of relapse also.
Okay. So you mentioned activities for that that are shared by the council or the therapist.
Yes.
Can you give us an example of what these activities could entail?
Yes, so the activities depends again. Again, I mean, it's about for the based on the client. So, for example, if you take one client with a depression, so it is a mild depression. Keep it like that, mild to moderate level of depression. So, if the client is coming for the therapy, so first we will do a talk therapy, make them understand. Yeah, so if I'm doing the counseling or if I'm doing the therapy for the client, so I'll start with the talk therapy, get the bond between, or the relationship between the counselor and the client is very important. Once that's have been built, then we will work on the activity. I mostly follow CBT. If the client is comfortable with CBT, then I'll go with CBT, where we will work on the small activities like journaling and time scheduling, and some introducing the activity which they like the most. So, like these kinds of activity, we introduce not at a time. I mean, one at a time, we will introduce and we'll do see that for 15 days how they coping up with, and slowly we will be no, taking them along with the way it has to be done.
Okay. Okay. CBT is cognitive behavioral therapy.
Behavioral therapy, yes.
Correct.
So for
I
some client, CBT won't work. They can't understand because CBT aims to help the client to understand their thought and the behavior and how they affect the client or the person. So some may not understand that. So for them, CBT won't work. So then we have to try some other therapy. It can be what do I say, transaction analysis where we do two-chair gestalt therapy is there. So a lot of therapies are available. Now we have a lot of therapies like art therapy, light therapy is there, dance therapy, psychodrama is there. So there's a lot of therapies available. So it's based on the client's need. We will, tailor made it and do the therapy accordingly.
okay. Okay. I have, and typically, what is after what is what after the duration of a you know of a therapy, you when is it defined that a person is out of depression or has success? What is it, happy? Would you typically call a person now who's been cured of depression? Is there a cure? No.
There is a cure if it is a, yeah, of course, there is a cure if it is a mild to moderate level. And that can be noticed after a six set of, I'm just randomly telling six, yeah, so six set of therapy, six session of therapy. So you could see the changes in the client, even in the third session you can see the changes of the client. Third, in the fourth session you could see the changes in the client, like they start, the energy level will be there, the involvement, the mood level that would have been reduced. So the changes will be seen if they are following the activities or the protocols.
Okay. Okay. And so is there a way to assess this, or it is just a matter of observation?
It is a matter of observation, and towards the end, we do assessment also.
Okay. Okay.
Yeah.
I have.
And again, it depends on each person, each counselor, I should say. So each one will have their own style of doing it.
Right. Right. I've come across the term seasonal depression as well.
Okay.
Can you help us understand what that is? Seasonal depression.
Yeah. So according to my understanding is 1 minute.
Okay. Because I believe in the UK especially, I've read that because it is it's always cloudy, dark, and gloomy. Kind of
Yeah,
the weather even sometimes
exactly.
makes
Yes.
it
Yes, so this is again the word itself says like season. So some may not like that season. So that time their mood level will be very low.
right, right,
So that time they'll go into a depression.
correct. So you've suggested multiple. You've suggested there are treatment patterns for this, and
Yeah.
when
So
I
for
joined
this light therapy will work.
light therapy, yeah, that's what I came about. Light therapy, correct? Because you have any? Is this needed? Do we practice this in India as in light therapy for our patients? Because it's pretty bright, right? We don't.
Yeah, so it's a good question. Even I'm reflecting on whether it is needed in India. I actually don't know. Like, no, let me be transparent. Like, I have just learnt about it. I haven't come across. So maybe for some cases it will help.
Yeah,
Chances
typically
are
we
there.
ask them to go out for a walk early in the morning. get the early.
That is there. That is always there. It's not only a light therapy for the seasonal disorder, even for any disorder or for any kind of mental illness. When you go out and see the fresh, inhale the fresh air, see the brightness and the nature, you will find a difference in you. You could have noticed that. So when you're very low in mood, just go out for a walk. Just for 5 minutes or 10 minutes, you will see the change.
Correct.
Their mood level would have changed. So that is always there. Whereas this light therapy, in the sense like, no, maybe it depends again on the context.
Correct. True. I thought as much because, when you don't have this direct, when you don't get the sun for a good amount of days, which is quite common in, rainy place or cloudy,
Yes.
you would need to have some sort of an alternate.
Yes, yes. Even in India, there's a lot of vitamin D deficiency, no, for all the men and women, especially for women and the old age people. So the doctor advised them, no, advise the deficiency people rather than having a supplementary, no, be under the sun for an 15 minutes or 30 minutes to get the vitamin D, and especially in the noon, 12 to 12:30 is the right time.
Oh,
So yeah, so we can relate that too.
correct. Yeah. I dropped. I forget my question. Yeah. What I wanted to understand was, can for kids, for children and teenagers, is there do teachers or now that everything's gone online and stuff like that, how was this? Can the school be involved in helping the children who are getting depressed? There's a lot of studies out there that are talking about children being, they're not getting to meet their friends, they're in isolation, for there's being a lot more care taken in how they interact with their peers. So this is especially on a global, scale, because I think in India the schools have opened up, right?
Yeah, schools are open for high secondary, like ninth, 10th, 11th, and 12th. Lower classes, primary, it's not open.
Okay. So
Yeah,
my question was, how is it that we can, when do we know a child is depressed? Do parents, how
yeah,
parents work with the child?
yeah.
Think.
So it's again the same symptoms which you can relate to the children also. If if a child is very active, involving in all the activities at home, helping the mother, going out and playing, very active in studies and sports. And if you could see that child during this, maybe in the COVID, the pandemic time, a little low, not in a mood to do anything, and always sleeping or not sleeping, not eating, and if there is any changes in the regular habits, then there is a chance of depression in that child.
Okay. And so the school, do schools have programs, or can the school do anything, improvise in the way they work with children who suffer from depression, or even probably, identify if a child is going through any symptoms of depression? Are there any programs? What can be done at a school level to manage this?
Yeah, if it is a school going child is going under depression, a teacher can talk to a child and find out why the child is not active. Maybe in a friendly way, as a chances for the child to open up. Or nowadays we have counselors in all schools. So a teacher, if she cannot speak, she can send the child to a counselor where the counselor can find out the reason and talk to the parents. So based on that, the interventions can be given, and it's very no easy. I won't say it's very what do I say, comfortable to handle the kids in the school. I mean, handle the kids, school going kids. Yeah.
Okay. And typically their friends would also be very, being around with their friends would
Yeah,
help.
sometimes being around with the friends will also help. And if the regular activity starts, then they will be okay. So it is quite common even for us, no, being at home. The pandemic time, everybody were at home, and especially women were taken for chores, doing all the house chores, And India, we are used to having maids and, taking care of all the work by the maids. And so that time even the maids were not there, and it was tough for the whole family itself.
Right.
So
Right.
once everything comes to normal, the things will become ease.
Understood. Understood. So, Priyadarshini, I think we're reaching. Thank you for sharing. I've tried to uh, answer questions that anybody could possibly have when it comes to depression, and I think we've kind of got there. Is there anything else that I think we should tell our audiences, or you would like to share with people who are looking for seeking help for depression?
Okay, so that rather than seeking for depression, I would like to focus on the mental health well-being, which is very important. So the awareness in India is much needed at present, like because the according to WHO, the rates of depression and anxiety disorder on the higher side. So, say in numbers, 56 million people are suffering from depression, and 38 million people are suffering from anxiety disorder. And though there is a slight awareness or little better when it compares to the past century, even there is a taboo and the negative notions about mental health illness. So I would like to talk about it because it's very much needed. Like, no, people are not accepting or willing to talk about the feelings to others, so which that is not being seen at the current scenario. So I would like to insist on that, like, no, the people if they are feeling low, talk about your feelings to your family members or to the friends or to somebody whom you can trust. So that will give you a kind of a vent out, so that will clear your whatever moods or whatever thing you have in it, that will have been go out. And I request everyone or everybody to follow exercise, physical and mental exercise. So the physical exercise which I talk about, the exercise which everybody do regularly, so that will boost your energy and gives you confidence. Whereas the mental exercise I talk is the breathing exercise and meditation. So deep breathing exercise, it's actually, it has a lot of good values in it. uh, when you do a deep breathing, you inhale a lot of oxygen, so which calms your mind, and this is the best for your depression and anxiety disorder. So this is one thing which everyone, not even the person who is affected of with mental illness, even the normal person, to take care of your mental health can do this. This I keep always insisting on this. Your physical and mental exercise is it should be a part of your daily activity. And the next is accept who you are. That's very important. Everybody is unique, so I am unique in my way and you are unique in your way. So if there's anything in me, I need to accept and see what help I need to do. For if there's any problem in me, I need to accept it and look for help. So which is very important. So that is, it's not seen now, not nowadays, it's not been seen at all. So that I like to insist on. So the next is, if you're not okay, it's okay. So it is okay not to be okay. That's
Yeah.
okay. So that's very important. And it's okay to ask for help also. If you could not, I mean, if you're not able to cope up with your stresses, it's okay to ask for help. And there are a lot of no educational educated psychologists, counselors, psychiatrists are available. And thanks to the technology, now we could do online counseling, we could do no video chat counseling, where those days it was not possible. So people can look for support. It's what I want to no, say.
Thank you, Priyadarshini. These were very useful, and it was a pleasure talking to you today. Um, I'm going to now wrap up. We're almost done, so I'm going to wrap up. I'm going to have a quick concluding note, and I'm sure that if anybody needs help, they know that they can reach out to us to connect with you. Correct? Yes.
Yes, not only to me. We have a lot of counselors in the platform available. Not only in this platform. I mean, there's a lot of counselors available. So even the
Correct.
psychologist and the psychiatrist, so they can reach out if they really can't, cope up with the pressures.
Right. Thank you. Thank you,
Thank you
Priya.
so much for having me. It's my pleasure.
Super. Just to in order to conclude with today's event, I'll just walk you through a quick. Uh, let's quickly understand that depression may become a serious health condition. It can cause affected person to function poorly at work, school, and at the family. At its worst, depression can lead to suicide. Close to
Yes.
800,000 people die due to suicide every year, and suicide is the second leading cause of death in 15 to 29-year-olds. These are staggering numbers, and we hope that today, with our conversation with Priyadarshani, we were able to explain in the most simplest way what is depression, what are the treatments available, because effective there are although there are known effective treatments for mental order disorders, between 76% and 85% of the people in low and middle income countries receive no treatment for their disorder. And barriers to effective care include a lack of resources, lack of trained healthcare providers, and social stigma associated with mental disorders. Another barrier to effective care is an inaccurate assessment, which is one of the reasons why we are breaking down the understanding of mental health with experts in the industry. So you can always, reach out to the right person and have clarity on what's needed on a particular topic. Please feel free to check our previous videos, which have been published every Sunday and including today's. And we continue to do this every Sunday at 6 p.m., talking to counselors and experts in the field of mental health. All right. Thank you very much, everyone. Thank you, Priyadarshani. I think we're going
Thank
to
you very much. Thank you, Alet.
we're going to sign out for the evening. Yeah.